Hi everyone, today I will present cell death, focusing on caseous necrosis and flat necrosis. Cell death is the permanent and irreversible loss of a cell ability to function, maintain homeostasis, and survive. There are two major types of cell death: apoptosis, which is programmed and regulated process, and necrosis, which occurs due to severe injury, infection, a lot of cell supply, and is often associated with inflammation. Today, I will explain the characteristics, causes, and differences between caseous necrosis and flat necrosis.
Caseous necrosis. Definition: sheath-right tissue necrosis, allocytosis with granulomatous inflammation, common in tuberculosis. Causes: Mycobacteria tuberculosis, fungal infection. Key feature: soft white, yellow sheath-right appearance, loss of normal tissue suction, surrounded by granulomas. Clinic characteristic of tuberculosis indicates chronic infection, miscut tissue rupture and cavity formation.
This slide explains the pathophysiology of caseous necrosis. It begins with tuberculosis, infections caused by Mycobacterium tuberculosis. The immune system responds by activating macrophages to destroy the bacteria. However, the bacteria cannot be completely eliminated. As a result, macrophages and other immune cells gather together to form a granuloma, which help contain the infections. Persistent infection lead to chronic inflammation, causing tissue damage and eventually caseous necrosis.
The next slide. This is a fat necrosis. Fat necrosis is the death of fat cell caused by enzyme or injury, and commonly occurs when lipids break down fat tissue. How is it happen? Number 1. Fat cell become damaged. Number 2. Lipids break down fat into fatty acids. Number 3. Fatty acid combine with calcium and form tracky deposits. Causes. Number 1. Acute pancreatitis. Number 2. Trauma. Number 3. Breast injury. Microscopic feature. Number 1. Loss of normal fat cell structure. Number 2. Presence of good fat cell and calcium deposition. Number 3. Inflammatory cell and macrophage may be present. Clinical significance. Number 1. Commonly found around the pancreas is acute pancreatitis. Number 2. In the breast, it may present as a palpable mass and mimic breast center.
Fat necrosis is the death of adipose fat tissue, most commonly caused by tissue injury of the action pancreatic enzyme, cause acute pancreatic leakage of the pancreatic enzyme, libel into a swelling tissue, trauma, injury to fatty tissue, and especially in the breast of substance tissue. Mechanism of fat necrosis. Fat cell adipocytes are damaged or destroyed. Lipid break down triglycerides into free fatty acids. Free fatty acids combine with calcium ion to form calcium salt. This process is called saponification. An inflammatory response occurs. Neutrophil and macrophage remove the dead tissue. Over time, fibrosis, scar formation, and calcification may develop. Common example: enzymatic fat necrosis occur in patients with acute pancreatitis due to death of pancreatic lipase, or traumatic fat necrosis occurs after physical injury, commonly in the breast or subcutaneous fat.
Fat pathophysiology and histology. Fat pathophysiology exists fat accumulated when energy intake exceeds energy expenditure. Enlarged fat cells release inflammatory cytokinesis. Chronic inflammation leads to insulin resistance, increase the risk of obesity, type 2 diabetes, cardiovascular disease, and fatty liver disease. Fat pathophysiology and histology. Fat pathophysiology exists fat accumulated when energy intake exceeds energy expenditure. Enlarged fat cells release inflammatory cytokinesis. Chronic inflammation leads to insulin resistance, increase the risk of obesity, type 2 diabetes, cardiovascular disease, and fatty liver disease.
Caseous necrosis is caused by tuberculosis, commonly found in the lungs, while fat necrosis is caused by acute pancreatitis or trauma affecting adipose tissue. Neck got appearance caseous looks sheath-right due to granuloma formation. In contrast, fat necrosis show shaggy white deposit from lipid activation and calcium binding called saponification. Finally, histology under the microscope. Cases show structureless granular deep brain, whereas fat necrosis retains the gross outline of dead fat cell with calcium deposits.